COVID-19. COVID-19 testing. Types of tests. COVID-19 tests are available that can test for current infection or past infection. A viral test tells if you have a current infection. Two types of viral tests can be used: a nucleic acid amplification test, or NAATs, and antigen tests. The antibody test, also known as serology tests, might tell if you had a past infection. Antibody tests should not be used to diagnose a current infection. Who should get tested for current infection? People who have symptoms of COVID-19. Most people who have had close contact within 6 feet for a total of 15 minutes or more over a 24-hour period with someone with confirmed COVID-19. Fully vaccinated people with no COVID-19 symptoms do not need to be tested following an exposure to someone with COVID-19. People who have tested positive for COVID-19 within the past 3 months and recovered do not need to get tested following an exposure as long as they do not develop new symptoms. Unvaccinated people who have taken part in activities that put them at higher risk for COVID-19 because they cannot physically distance as needed to avoid exposure, such as travel, attending large social or mass gatherings, or being in crowded or poorly ventilated indoor settings. People who have been asked or referred to get tested by their healthcare provider or state, tribal, local, or territorial health department. CDC recommends that anyone with any signs or symptoms of COVID-19 get tested, regardless of vaccination status or prior infection. If you get tested because you have symptoms or were potentially exposed to the virus, you should stay away from others pending test results and follow the advice of your healthcare provider or a public health professional. How to get tested for current COVID-19 infection. Contact your healthcare provider or visit your state, tribal, local, and territorial health department's website to find the latest local information on testing. The type of viral COVID-19 test offered may differ by location. You and your healthcare provider might also consider either an at-home collection kit or an at-home test if you have signs and symptoms of COVID-19 and if you can't get tested by a healthcare provider or public health official. How to use results of viral tests. If you test positive, know what protective steps to take to prevent others from getting sick. If you test negative, you probably were not infected at the time your sample was collected. The test result only means that you did not have COVID-19 at the time of testing. Continue to take steps to protect yourself. Viral tests are used to look for current infection. A viral test checks specimens from your nose or your mouth to find out if you are currently infected with the virus that causes COVID-19. Viral tests can be performed in a laboratory, at a testing site, or at home or anywhere else. Two types of viral tests are used: a nucleic acid amplification test, or NAATs, and antigen tests. Who should get tested? The following people should get tested for COVID-19. People who have symptoms of COVID-19. People who are fully vaccinated with COVID-19 vaccine should be evaluated by their healthcare provider and tested for COVID-19 if indicated. People without symptoms of COVID-19, such as people not fully vaccinated with COVID-19 vaccine who have had close contact with someone with confirmed COVID, including a person who does not have symptoms within 10 days of their positive test result. People not fully vaccinated with COVID vaccine who have not taken part in activities that put them at higher risk for COVID-19, such as attending large social or mass gatherings or being in crowded indoor settings. People not fully vaccinated with COVID-19 vaccine who are prioritized for expanded community screening for COVID-19. People not fully vaccinated with COVID-19 vaccine who have been asked or referred to get testing by their school, workplace, healthcare provider, state, tribal, local, or territorial health department. Who does not need to be tested? The following people who have been exposed to someone with COVID-19 do not need to get tested if they do not have COVID-19 symptoms. Persons who are fully vaccinated with COVID-19 vaccine not living in a congregate setting. For residents in non-healthcare congregate settings such as correctional and detentional facilities or group homes, and employees of residential congregate settings and high-density workplaces, such as meat and poultry processing and manufacturing plants, refer to CDC's recommendations for fully vaccinated people. People who have tested positive for COVID-19 within the past 3 months and recovered, as long as they do not develop new symptoms, do not need to get tested. How to get a viral test. Visit your state, tribal, local, or territory health department's website to look for the latest local information on testing. Visit your healthcare or public health department clinical provider to get a self-collection kit or self-test. You and your healthcare provider might consider either self-collection kit or a self-test if you have symptoms of COVID-19 and can't get tested by a healthcare provider. A positive viral test. If you test positive for the virus that causes COVID-19, take the following steps to protect others regardless of your COVID-19 vaccination status. Isolate at home and isolate away from others for at least 10 days. If you do not have any symptoms, you should still isolate at home for at least 10 days. If you develop symptoms, continue to isolate for at least 10 days after symptoms began, as long as symptoms have improved and no fever is present for at least 24 hours without use of fever-reducing medications. Most people have mild COVID-19 illness and can recover at home without medical care. Contact your healthcare provider as soon as possible if you are more likely to get very sick because of being an older adult or having underlying medical conditions, or if your symptoms get worse. Talk to your healthcare provider or local health department to find out how long to isolate if you are severely ill with COVID-19 or have a weakened immune system, had a positive test result followed by a negative result, test positive for many weeks after the initial result. A negative viral test. If you test negative for the virus that causes COVID-19, the virus was not detected. If you have symptoms of COVID-19, you may have received a false negative test result and still might have COVID-19. You should isolate away from others. Contact your healthcare provider about your symptoms, especially if they worsen, about follow-up testing and how long to isolate. If you do not have symptoms of COVID-19 and you were exposed to a person with COVID-19, you are likely not infected, but you still may get sick. Self-quarantine at home for 14 days after your exposure. Persons who are fully vaccinated with COVID-19 vaccine do not need to self-quarantine at home. For residents of non-healthcare congregate settings and employees of residential congregate settings and high-density workplaces, refer to recommendations for fully vaccinated people. Contact your local health department regarding options to reduce the length of quarantine. If symptoms develop during home quarantine, contact your healthcare provider about follow-up testing. Isolate at home, separated away from others. If you do not have symptoms of COVID-19 and do not have a known exposure to a person with COVID-19, you do not need to self-quarantine.